Hey everybody, this is Dr. Kyle with Ice Clinics bringing you your next tip for Tuesday. For our tip today, I just wanted to share an experience I had in the clinic earlier today for someone that came in with a chronic knee issue. They had tried a few different things. They had gone to different doctors. They had gone to an orthopedist. The orthopedist had done some injections for them. They did some imaging, and they were still having this chronic knee trouble to the point that it was preventing them from doing a lot of the active stuff that they would normally do in their life. So the reason I wanted to share this experience is because a lot of what I found from an assessment standpoint in here was the knee was not the issue. We were looking at different body parts like the hip, the ankle, the low back that all were contributing to the knee, and unfortunately the knee was taking the brunt of that issue. So one little refresher I wanted to have you guys focus on, and I've done videos on this in the past with the knee, is remember the knee anatomically is a relatively simple joint. Most of its function is into what we call flexion and extension, so bending it forward and straightening, and there's a mild degree of twisting. So when you consider these two functions of the knee, you can see how certain anatomy can get irritated that would cause a lot of knee and pain symptoms. In particular, bursitis is a common one with knee. You can also get tendinitis in here, and then you can also have some meniscus. That blue guy right here that you see is the meniscus. You can get irritation to the meniscus without actually having damage to the meniscus or damage to those collateral ligaments around them. So when you consider the mechanics of the knee, you can also see how there's a wide range of issues that would not necessarily mean you have damage to the knee, but can cause a lot of the pain, maybe even swelling and weakness around that particular knee. So when we started to look upwind with this patient, especially the hip, we saw some major compromise. And they happen to be a former basketball athlete. So when their stable jumping leg was their left leg, which is the same pain they had their knee on. So a lot of what was happening is their normal daily routine of how their muscle memory was. Every time they would land on this left leg, their major shock absorber in their hip wasn't engaging, and the knee was taking the brunt of it. And because this had been going on for such a long time, it created an imbalance of swelling in the knee. And then the swelling led to muscular imbalance here in the quad, where the quad started getting weaker and the hamstring started getting really tight. And so now this patient was kind of just going down a pathway that was not leading towards anywhere of a resolvement of this issue. And she was trying to avoid surgery as best as possible. And so point being, considering the simplicity of the knee, if you have a chronic knee issue that's just not going away and not finding the resolution that you're looking for, really think about considering what's going on around that. Low back, remember, especially when we look at the nerve roots that come off the low back down here, L3, 4, 5. L5 especially, you can see goes to your lower legs, ankles, feet, which in particular can lead to poor circulation, swollen ankles, weak arches, so like rolling ankles. So it's very easy to see that maybe an issue that originated in the low back all of a sudden starts to manifest its way downwards, and we lose the bigger picture of why that injury occurred because we just focus on the spot that's having pain. So hopefully you guys have gathered this from all the videos. A lot of our approach here in this clinic is an overall body assessment, and we like to get at the root cause of where problems have originated. So if you're somebody that's struggling with a chronic knee issue, please consider seeing a chiropractor, especially an extremity-based chiropractor, and please reach out to us if you have any more questions. Again, my name is Dr. Kyle with Ice Clinics. Thanks for watching.